young people ages 11 and 12 receive the HPV vaccine series. This means that they are reducing their risk for HPV-related cancers by a huge amount. So by getting the HPV vaccination before one is ever exposed to HPV, young women are reducing their risk for cervical cancer by 90%. Young men that get the HPV vaccine are reducing their main cancer risk from HPV would be oropharyngeal cancer, and they're preventing up to about 70% of oropharyngeal cancers. So this is really taking out the lion's share of HPV-related disease and cancer.
The poster is about enhancing HPV immunization rates in North Dakota the youth through a process of improving our AFIX process with the State Health Department. First dose of HPV vaccine overall is somewhere typically in the 60% range, 50-60% range. Completion of the vaccine is as low as 30 to 40% range. And that may be plateauing. So there's a real problem or disparity between the opportunity to give the vaccine, yet it's not happening. We think a big part of the problem is actually with the doctors and other providers themselves. They overestimate parents' concerns about it. They have their own concerns about the safety, necessity, efficacy of that vaccine. So we think that medical encounter between that physician, other provider, the parent, isn't going the way it's supposed to go. And so we wanted to provide evidence-based methods and communication strategies for those providers to get through that process and make it happen at that encounter where it really needs to happen in that very young age group.
So our program looks to bring peer educators around the state in a luncheon format to provide education at each individual clinic, not only providing assessment and feedback on the rates that we've seen in these clinics, but also mainly focused on educating about the HPV disease, the safety and efficacy of the immunization, and then simple communication strategies that will improve HPV vaccination uptake and completion of the series.